Hello,
Hello.
welcome to this interview, and I'm going to ask you a question about global health.
Thank you.
Global health seems to be in news more and more in recent years. Talk about what global health is and why it's important to pay attention to it.
So thank you for your question. Global health is an area for study, research and practice that places a priority on improving people's health and achieving equity for people in the world, for all people in the world. So it's very important to pay attention to global health because so the chronic diseases, in case of those diseases caused by infection, it's global health will take initiative by making research, by finding some practices and by finding some medication for all those diseases in the world. So it's very important to pay attention to it.
Disease can come to us in different ways. Explain difference between communicable and non-communicable disease.
That's a good question. So non-communicable disease are those diseases that are not caused by infection or those diseases that doesn't last longer. For example, an example of a non-communicable disease is malaria, because something curable that cannot last longer. And communicable disease are those diseases that are caused by infection and that last longer. Example of communicable disease, they are diabetes, they are HIV, and those diseases most of the time it leads to death.
Let's talk about Ebola, since I'm sure most of our viewers have heard a lot about that. What is it, and is it a communicable or non-communicable disease, or how do people get it?
So thank you for that question. People have been wondering what is Ebola, what's how people get Ebola. So Ebola is known as an hemorrhagic fever, and it's a mortal disease because most of the time Ebola leads to the death. And also what I can say, Ebola has been found in 1976 in DRC. So Ebola has been found near the river Ebola in DRC. That's why it is called Ebola. But now Ebola is spread and it is found in several countries in Africa. So Ebola is caused by Ebola viruses, and it attacks human being and non-human primates because it has been found in some animals, and people are even saying that Ebola was coming from an animal, but that is not sure because researchers is also working on that, but even today we don't have like a clear response about that. So how do people get Ebola? So Ebola is, first of all, it's a communicable disease because it is an infection, it's a fever. It is spread by people. If you have how people get Ebola, people, if you have a direct contact with people who have Ebola, you get it. It can be from an oral contact, it can be from, even if you touch a dead body with a person who was having Ebola, you can even get Ebola. So it's communicable diseases because people can spread it, and one person can spread it to 15 people. So it's a communicable disease, and but it doesn't last longer because people, if you receive a treatment, people who have Ebola can live for 3 weeks or 4 weeks, but it's spread. But that's why we call it communicable disease.
What would raise a person's risk of getting Ebola?
So as I was saying, Ebola is a very, if I say a chronic disease, and people who have Ebola most of the time they died. Even people who recover, they put them aside to see that if they can survive. So what you risk for if you have Ebola, it's death and also a fever.
So to prevent or at least lessen the chance of getting Ebola, what should people do?
So to prevent or to decrease the chance of getting Ebola, for example, what people need is education about Ebola. Because if people knows what is Ebola, what are the signs of Ebola, they can decrease the chance of getting it. Because if, for example, what I can say about that, what people can do to prevent or to decrease the number of people who are getting that fever infections is that if you find someone in your area, in your neighborhood who is having the signs of Ebola, just directly contact the hospital which is near you, and then if the hospital confirm that that person is presenting the signs of Ebola, they just need to find a way to put that person far from others, because if that person starting spreading those infections, it's very hard to control like the situation. So what you can do, if you're listening to me, you just, if it is someone found it with the signs of Ebola, just try to put him or her far from others, because if you just get the treatment to that person, and then that person go to where he lives or she lives, she can or he can spread those infection. As I say, that it's a communicable disease, and to decrease to decrease the chance of getting it, you go immediately to the hospital and then stay far from others in order to avoid spreading that infection.
So outbreaks such as one related to Ebola can generate a lot of rumors and misinformation, and even panic about what the disease is and how it is transmitted and how likely people are to get it. Talk about the need for educating people about facts and myths.
So thank you for this question. I need to emphasize on this. Some people are having misinformation, and also I understand that people panic about Ebola because, as I said, it's a mortal disease. So Ebola, what you need to know about Ebola is this. Just know what is Ebola, what are the signs of Ebola, and then what should I do in case I find a person or I think someone is having the signs of Ebola. What should I do? So as I was saying, it's very important the government invest on educating people about Ebola. And also this is a worldwide thing. If you don't educate people, and for example you're having a person traveling to a country where there is Ebola, so if that person is transporting Ebola without knowing it, if you don't educate those people about that, it will be very difficult to control the situation in the country or worldwide, because Ebola is, as I said, it's a communicable disease. There is a high chance that people can get it. So education is very needed in that area, because you need to educate them, tell them what is Ebola, how is it, how can people get it, what should I do in case I find a person, or I thought even thinking about someone is getting the signs of Ebola can help people. Like if you educate, it can help people to know what can do in case I find someone having Ebola, or I thought my daughter or my neighbor is having Ebola. Education is very important to this point.
How about the complication that Ebola raises for the right of travelers and responsibilities of government? Cassie Hikos, for example, a nurse from Maine who returned to the States following a trip to West Africa in the fall of 2014, promptly had quarantine-related restriction thrown upon her, restriction that she was very much against. Briefly describe the difficulty of balancing individual rights and government responsibilities.
So thank you for that question. So as I was saying that Ebola is a worldwide thing, so as that nurse was putting in the quarantine, so the government have to look at the things in a general statement, not looking for the personal reason of that one person, because as the government has the right to protect its citizen, and that's the nurse was coming from a country where there was Ebola, so the responsibility of the government was protecting its citizen, to note that the nurse may, for example, if she was having Ebola signs, or because she was coming from a country where there was Ebola, and also the government has to look at general benefit for its citizens. So they just put, if a person is coming from a country where there is Ebola, what they need to do is put him or her in a quarantine in order to pass some tests or some exams, in order to see that if that person is not transporting Ebola with her. As I was saying, that it's something which can be it's a communicable disease, so the right of the country is to protect its citizens. They have to look at general reason for the country, not for one reason for a person.
Let's talk about smoking and tobacco use, which is considered a big world health problem and raises similar to Ebola in terms of light and responsibilities. Just about everyone knows that smoking harms health. What does it do to the body?
So as people know that smoke is harming, but people continue to do it as a normal thing. But let me tell you something. Smoking leads to disease and disability and harms every organ of the body. Smoking can lead to death, as it's made death through different diseases. There are some people who get several asthma. There are some people who get diabetes. There are some people who get chronic bronchitis. In addition to this, it increases the risk of tuberculosis, and that's chronic disease which can lead to death in a longer term. So smoking, it can be taken of something which can lead to death, two different diseases, and it's very harming every simple organ of the body.
What about second-hand smoke, and explain what is it and how it affects people?
So second-hand smoke is when someone is smoking and you are near him or her, and then you get affected by the smoke that person was smoking. So this is very, very crucial to cause it causes diseases to people near those people who are smoking, those people who smoke in public places. So it's very harmful, especially for children. If you are a mother and you are smoking near your children, so understand that you are harming your children, because it can cause cancer, it can cause heart diseases, and also it can cause infant death syndrome and respiration infection for children, and also it can increase the chances of getting lung cancer for adults. So it's very if you are smoking in public places, that's second-hand smoke, and you are very harming people near you.
People don't typically think tobacco as a drug like heroin and cocaine, but the addiction it creates is strong, isn't it? Should we think of tobacco use as a form of substance abuse?
So what I can say about this is that people doesn't consider smoking as a drug addiction, but it is, because smoking cigarettes are made in nicotine, and people get addicted to nicotine. And when people addiction is when people do something once, twice, and then can abstain themselves for doing that. So if it's a repetitive thing and you can't survive without doing it, it's an addiction, and it is considered as drug addiction.
Thank you for talking to us.
Thank you.